So we can start now.
Sonu, please.
Okay, sir. Good evening to one and all. If you can dream it, you can do it. Walt Disney. The most respected pharma fraternity. The very first pharma professional organization in Kerala, Kerala Pharmacy Graduates Association, KPGA, is here to give wings to those dreams. We are here with our webinar series on overseas career and research opportunities for pharmacy students and presenting today the sixth module on registered pharmacists in United Kingdom, how to become one and different career options. I am Sonu Benny, PhD research scholar under the School of Pharmacy, the privileged master of ceremony of the day. With immense pleasure, on behalf of Kerala Pharmacy Graduates Association, I would like to invite all of you to this gracious occasion of the sixth module of the webinar series, Registered Pharmacists in UK, How to Become One and the Different Career Options. Hearty welcome, one and all. Let's begin with a prayer song to seek blessings from God Almighty. Let's begin with a warm welcome note. It is my privilege to welcome an enthusiastic pharma regulator, Mrs. Gladys P. Kachapalli, Drugs Inspector, Office of the Assistant Drugs Controller, Ernakulam, to welcome the gathering. With much happiness, over to you, ma'am.
A very good evening to one and all present here. With warm greetings, it is a great pleasure to extend a warm welcome on behalf of Kerala Pharmacy Graduate Association, conducting a webinar on registered pharmacist career opportunities in UK by Mr. Ajith Adai. Mr. Ajith Adai, speaker of this section, is a medical affairs lead at Galderma Limited UK. We are very fortunate to have such a well-experienced person to deliver his valuable information in this arena. On behalf of Kerala Pharmacy Graduate Association, I welcome you, sir. With immense pleasure, I welcome Dr. Kala, Professor and Head of the Department, College of Pharmaceutical Sciences, Alappuzha, who is chairing this program. I welcome you, ma'am.
Thank you.
With much delight, I am very happy to welcome Dr. K.J. Dilip, Professor of College of Pharmaceutical Sciences, Thiruvananthapuram, who is introducing the module of this session. I welcome you, sir.
Thank you.
I am very happy to welcome Dr. Sujay Abraham, Professor of MGM Silver Jubilee College of Pharmaceutical Sciences, Pambakuda, Ernakulam, who is the moderator of this great event. I welcome you, ma'am.
Thank you.
Also, I welcome Mr. Abdul Nasser, who is designated to deliver the vote of thanks in this webinar. Welcome you, sir. Kerala Pharmacy Association, KPGA, is the voice of pharmacy graduates in Kerala. KPGA always stands for the upliftment of pharmacy professionals in Kerala. Also, KPGA conducted a number of workshops and webinars for student community and thereby contribute a lot to the pharmacy aspirant, that is, our future pharmacists. On this auspicious occasion, I would like to welcome our President, Dr. P.K. Srikumar Sir, Secretary, Mr. Abdul Nasir Sir, and other office bearers of KPGA to this webinar.
Thank you.
Also,
Thank you.
I welcome all faculty members from various pharmacy colleges, all pharmacy professionals, and all the students to this webinar. All our dreams come true if we have the courage to pursue them. I'm sure that this webinar would be meaningful and useful for all the aspirants in pharmacy profession. Once again, I welcome all the participants to this program. Thank you, one and all.
Thank you so much, madam. With much respect, let me invite a very impulsive and eminent, well experienced pharma professional as the chair of the event, Dr. Kaladi, Professor, Head and College of Pharmaceutical Sciences, Government TD Medical College, Alapura. With much respect, over to you, ma'am.
Thank you, Sonu. Respected dignitaries, colleagues, students, and dear pharma professionals, a warm good evening to one and all. We all know that pharmacy profession is in a revolutionary phase. Increasing number of hospitals, nursing home, pharmaceutical companies all over the globe is a clear indication of the growing scope in pharmacy profession and thus offering excellent and rewarding career opportunities. In Western countries, the doctor diagnoses the disease and the pharmacist is the one who decides the medicine and its dosage. Therefore, the pharmacy graduate have an important role and can earn attractive remuneration and can occupy strategic position. In this fast developing world, research and development in pharma industry is progressing and advancing at a very high speed, which calls for pharmacy graduates with attractive financial package in spite of the economic crisis prevailing now. Kerala Pharmacy Graduates Association has been conducting different webinars in this regard. It helps students broaden their knowledge and provide interesting and informative platform for clarifying their doubt. Today I am happy to be with my student Ajith Adai. Dear pharmacy scholars, explain this opportunity, explore it, grab the maximum. Success comes from taking the initiative and following up. I hope this session will give you overall information about the scope of pharmacists in UK. And any queries, please put in the chat box and clarify your doubt. Thank you.
Thank you so much, madam. It is really a great blessing to be here with a successful story of the webinar series for the 6th module of the same. To introduce the module with pride, I would like to invite a distinguished pharma professional, Dr. Dilip KJ, Professor of Pharmacy, College of Pharmaceutical Sciences, Government TD Medical College, Alapura. With much respect, over to you, sir.
Thank you, Sonu, and good evening to all. Respected senior faculty members, other senior pharmacy professionals, colleagues, and dear students. First of all, I would like to thank the organizers of this program to give me an opportunity to participate in this webinar. As we all know, that around 3,000 BPharm students are graduating each year from the Kerala University of Health Sciences, and more are coming from our neighboring states. And finding a job, a good job, is a big task. Of course, students are of different orientation and taste. Selection of a particular area of interest is often difficult without proper guidance. To become a registered pharmacist in UK is a good opportunity. But as far as I know, the number of pharmacy colleges imparting graduation is very less in UK compared to in our state. And also the licensing procedures are very strict and stringent, and having a good understanding of these procedures will be an added advantage for those who are going for it. I am proud to have Mr. Ajith Adai, one of my students, to present this topic on registered pharmacist in UK, how to become one, and different career options. I hope this webinar will be useful for the students to pursue their dreams. Thank you. Thank you very much.
Thank you so much, sir. The apt resource for the very relevant talk. It is our fortune to have Mr. Ajith Adai, Medical Affairs Lead and Final Medical Signatory, Galderma Limited, as the speaker of the day. Let's listen more about our eminent speaker. At this juncture, let me welcome a great pharma academician, Dr. Suja Abraham, Professor, MGM Silver Jubilee College of Pharmacy, Pambakuda, Ernakulam, to moderate the session and to introduce the eminent speaker of the day. With much respect, over to you, ma'am.
Suja madam. Could you please unshare the screen? Suja madam.
I think it's muted.
Suja is muted.
Madam, please unmute.
Suja madam, mute ആണല്ലോ.
Actually, her video was on.
ഒന്ന് റീലോഗിൻ ചെയ്യാൻ പറഞ്ഞാൽ മതി.
ഹലോ, കേറാൻ പറ്റുന്നുണ്ടോ? ഹലോ ഹലോ
സർ.
ഇപ്പൊ കയറി.
Nasirji, is there a net issue?
സാറേ, അതല്ല, ആ സിസ്റ്റം ഒന്ന് മാറുകയെന്ന് പറഞ്ഞു. അതെന്തോ കമ്പ്യൂട്ടർ മാറുകയെന്ന് പറഞ്ഞു.
ഒരു മിനിറ്റ്, ജോയിൻ ചെയ്തിരുന്നേ.
ജോയിൻ ചെയ്തു. ഇല്ല സാറേ, കയറി സാർ.
സുജ മാഡം, പ്ലീസ് അൺമ്യൂട്ട്. ഓക്കെ.
Okay. Good evening, sir. Sorry for the inconvenience. So, it's a very good opportunity to introduce today's speaker, Ajith Adai, sir. Sir, this program is also one of the main interesting topic. Actually, UK is one of the interesting preferred location for all the young professionals. So, it is a great opportunity to listen, Ajith Adai, sir. So, sirs, let me introduce sirs. Ajith Adai, sir, graduated from Kerala and then moved to UK. And had done post-graduation from University of Brinton. And then he registered as a pharmacist with the General Pharmaceutical Council. And he had membership of many prestigious societies like Royal Pharmaceutical Society of Great Britain and Medical Science Liaison Association and HIVPA. And Sir's career history, Sir worked as a pharmacist for around 7 years in different roles as a responsible pharmacist, clinical pharmacist, and home care pharmacist, and then moved to pharmaceutical and biotech industry as a senior specialist, associate director, medical affairs, lead respiratory dermatology, and then medical signatory. So many professional roles he has. And Sir has clinical skills and experience in various areas like MHRA, ABPI, final medical signatory, pre-launch and launch expertise in various HIV products, then NICE, SMC, and other submissions, country medical affairs plan. So likewise, so much of experience and clinical skills us have. So we are fortunate enough to listen to Ajith Adai sir, and I hope today's session will be an eye-opening to a young professional, especially for many research as well as career opportunities. With immense pleasure, I welcome you, sir, to today's session. Over to you, sir.
Okay, thank you for the great introduction. Let me share my screen first. So before that, respected Dilip sir, respected Kala madam, and all the pharmacy professionals. I understand that a lot of you are actually teachers or professors in different universities. So it's a great pleasure to be here to present to you about the pharmacist opportunities in the UK. Let me share my screen. Are we allowing people to ask questions as we go along, or do we do that at the end of the presentation? How does it work?
Participants can they can write their queries in the chat box. At the end, we'll discuss it.
Okay, excellent. Okay, can you see my screen?
Yes, sir.
Okay, brilliant. Okay, thank you for the nice introduction. So what I'm going to do today is I'm going to talk to you about the registered pharmacist in the UK, how to become a registered pharmacist. That's the first part of the presentation. And the second part of the presentation, I'll be speaking about different pharmacist opportunities like community pharmacist, hospital pharmacist, and industry pharmacist. So before I speak about the pharmacist registration, it's important to talk about the pharmacy regulators in the UK. So the first one I wanted to touch on is the General Pharmaceutical Council. So General Pharmaceutical Council, or GPAC, is the regulatory body of pharmacists, pharmacy technicians, and pharmacies in the UK. Like Dilip sir briefly touched, the regulation in the UK is very strict, very stringent processes. So we have a regulator in the UK. It's like Kerala Pharmacy Council, I think. That's where you register. So basically, General Pharmaceutical Council regulate pharmacy profession, and also they set standards for pharmacy professionals and pharmacists. And this is the council where you need to get registration from for you to practice in the UK. So General Pharmaceutical Council is where you register to become a pharmacist. And that's the name you need to remember. And I'll be speaking about GPAC quite a few times in my presentation. So that is the regulator. The next one you might have heard about is the Royal Pharmaceutical Society of Great Britain. So Royal Pharmaceutical Society of Great Britain is not a regulator. Instead, it's a membership body. You don't need a registration with Royal Pharmaceutical Society to practice in the UK, but Royal Pharmaceutical Society membership will allow you to learn a lot of stuff because they provide a lot of support in terms of educating pharmacists. Also, they play an important role in promoting pharmacy in the media and government. Also, membership in Royal Pharmaceutical Society will allow you to give you a tail. I don't know if you've seen people like Ajith, Adai. You can add MR Pharm S, member of Royal Pharmaceutical Society, like MRCP for doctors. You can add MR Pharmacist at the end of your name if you have membership with Royal Pharmaceutical Society. But like I've said, the membership with Royal Pharmaceutical Society is not mandatory, is an optional. You can opt in or opt out, but your membership or registration with General Pharmaceutical Council is absolutely mandatory for you to practice in the UK. Okay, so let's move on to the registration process. So first part of the registration process is, of course, your pharmacy qualifications. So you need to have a B Pharm or an M Pharm or PharmD. Unfortunately, PharmD, if you qualify as a PharmD graduate, you don't have any additional advantage when it comes to the registration of your pharmacy in the UK. However, if you have a PharmD qualification, of course, that is going to be beneficial when you apply for jobs, because PharmD is, of course, a doctorate qualification which will allow you to give you lots of additional benefits when you actually apply for the jobs. But for your registration purposes, all you require is a pharmacy qualification, i.e. B Pharm, Masters or PharmD. The second important aspect to think about is the English requirement. So you need to pass the English requirement exam, which is IELTS, with a minimum score of 7 in individual topics like reading, listening, writing, and speaking. You need to actually get individual 7 marks for IELTS, and then, or you can have pharmacy occupational educational qualification as well. So that's a pharmacy OET with a score of B. So when I've done my conversion and my registration, there wasn't any pharmacy OET. So I was actually doing IELTS. So English requirement is absolutely mandatory. And I've seen many graduates from Kerala in here in the UK, and a lot of people actually fail here to get that 7 marks for individual IELTS areas. The next part of the process is the verification of your qualifications. So you have your pharmacy qualification, your B Pharm, M Pharm or PharmD. You have your English requirement, which is your IELTS or pharmacy OET. Once you have your pharmacy and English, the next part of the process is to send your applications and everything over to General Pharmaceutical Council. So the purpose of sending it to General Pharmaceutical Council is this is the opportunity to assess the qualifications we obtained in India. So this is the time you send all the applications over to General Pharmaceutical Council. So you need to send your degree certificate, ENIC statement of comparability. So statement of comparability, ENIC, you can obtain the ENIC statement of comparability from the UK NARIC website. Not sure if you've heard about UK NARIC. So UK NARIC is an organization which compares foreign qualifications to UK qualifications just to assess the quality of education. So what you can actually do, you can apply to UK NARIC, who will then provide you a comparability statement just to say that the Indian qualification is comparable to that of the UK qualification. Your transcript, your references, everything will have to be sent directly from the university and from the referees to the university here. So the third part of the process is to submit all your qualifications, all your paperwork, everything to General Pharmaceutical Council for them to assess whether you're eligible for a university degree or a university qualification called OSPAP. OSPAP is Overseas Pharmacist Assessment Program. It lasts for a period of 1 year. So after the verification of qualifications by General Pharmaceutical Council, they will advise you to take the Overseas Pharmacist Assessment Program in one of the universities in the UK. In the UK, currently about 4 to 6 universities provide this course. So after obtaining the go-ahead from the General Pharmaceutical Council, you will then apply for a place in the university to do Overseas Pharmacist Assessment Program. Important thing to remember is, like I've said, it is going to last for 1 year. It's like a proper university qualification, which means that there will be exams at the end. I think you need to clear about 5 to 7 papers, and it's going to cost you about £12,000, which is about 12 lakhs Indian rupees. It is not very cheap. So this is a 1 year qualification. So once you finish with your qualification, the next part of the process is the training of the so training under a senior pharmacist. So you qualify your university qualification, finish off the exams, pass the exams. Then the next part of the phase is the pre-registration training. So pre-registration training means you will be practicing under a senior pharmacist in community hospital or industry. At this point in time, you will be getting a lot of practical exposure and practical experience in terms of how to deal with patients, how to deal with the stocks, how to deal with other healthcare professionals like doctors, nurses. So that's a great opportunity to have hands-on experience on how pharmacy actually works. And the next part of the process is another exam, which is the final exam after the training, which consists of 2 papers, one on calculations and the other one multiple choice questions. You pass this exam as well and send the registration details over to General Pharmaceutical Council for you to register as a pharmacist. So I'll just recap really quickly. So you obtain your pharmacy qualification, BPharm, MPharm, PharmD. Make sure you have a proper IELTS mark, which is 7 marks for individual areas. So your pharmacy qualification, English, you pass all of that. Send all the qualifications, references, statement of comparability, everything over to General Pharmaceutical Council for them to assess, to make sure that you are eligible to do pharmacy conversion or overseas pharmacist course in the UK. Once they assess, they will then advise you to do a university qualification, which is OSPAP or Overseas Pharmacist Assessment Program. The overseas course, the university course, lasts for a period of 1 year. After 1 year, 5 to 7 papers, you clear the papers, pass the exams, then move to the next part of the process, which is the pre-registration training, which is the training under a senior pharmacist for a period of 1 year again. Then do another final exam, consists of 2 papers, and send everything over to the General Pharmaceutical Council for them to register. Now, when you look at the different processes, you will think that this is going to be so tough. Trust me, if I can do it, you can do it. There's lots of Kerala pharmacists are actually here, registered, practicing as pharmacists in community pharmacy, hospital pharmacy, industry pharmacy, home care, different setups. And if I can do it, everyone can do it. So the important thing is you take a decision and start getting into the process. And once you start the process and once you're in the process, things will move fairly quickly. Once you fall into place, it moves automatically. If you have any questions, feel free to add to the chat or speak to the moderator, and I'm happy to address questions after the session. Okay, so a couple of important things. Just wanted to share with you some tricks and tips, and I have a disclosure here. During my college days, I haven't done any of this. So I was interested in a lot of other things, like many of you are. I haven't done any of these, but this is the thing I've learned from my experience. I've learned it in a hard way. The first, the most important thing, in my opinion, is to have a good language. So start your preparations as soon as you can, as early as possible. You need to actually improve your verbal and written skills. It's not just for IELTS. It's for your future. It's for your interviews. It's for your jobs. It's for your progression, promotion, everything. You need fantastic language skills, verbal, written. It's absolutely mandatory. If you have better language skills, of course you can progress in your ladder fairly quickly. Second one I wanted to actually touch on is the soft skills. So what do you mean by soft skills? Soft skills are like your communication. Communication is not about knowing English. It's about the way you communicate the message to your colleagues, to your manager, to your subordinates, to the board of directors. So it's about how you communicate, how you express yourself to the rest of the crew, and that's what the communication skills is about. Interpersonal skills is absolutely vital, especially if you wanted to work in a pharmaceutical company or a biotechnology company. Interpersonal skills are absolutely key. So what do you mean by interpersonal skills? It's all about how you're interacting with your colleagues, with your friends, with your mates, with your people in the business, with your colleagues, with your subordinates, everyone. So it's about interpersonal, how you present yourselves to people, how you're interacting, how how do you deal with situations, and also presentation skills is absolutely vital as well, because in my sort of day-to-day job, I do at least present at least once in a couple of weeks, at least once. I mean, sometimes once in a week, sometimes pretty much a few days continuously, but I do a lot of presentations. So soft skills are absolutely important. So when you do your university course or just after your qualification, think about your language skills, think about your soft skills, and they're all absolutely important, not just for qualifying your IELTS, but it's important for you to progress your career of pharmacy in the UK. The whole stuff take a lot of time. You can see it. It takes about 2.5 years overall. Your IELTS, your qualifications, your university degree, your pre-registration, visa, it all takes a lot of time. So the most important thing is plan in advance. Think about it. Think, what do you want to do? Do you want to go to US, UK, some other parts of Europe? Have some understanding. And I just wanted to repeat, I have no clue of my future when I was doing my pharmacy qualification. I was a completely clueless boy. But I've learned these things in a hard way, and that's what I'm sharing with you. So it takes a bit of time, so plan in advance. And the next important thing to remember is a positive mindset. Because when you move from a country to another country, so forget about it. If you're moving from Kerala to Mumbai or Bangalore, for example, there will be lots of struggles. So prepare for struggles. You will be struggling, I can tell you. If you're moving to UK tomorrow, you will be struggling for a few years of time with financial struggles. You need to actually think about your visa, your work permit, a lot of stuff. So think about it in advance. And also have some proactive thinking and action. What am I going to do? So am I going this, UK? Okay, I'm going to qualify as a pharmacist, and what I'm going to do? Am I going to work in community pharmacy, hospital pharmacy, industry pharmacy? Where are the niche areas where I can progress better? So a lot of this is absolutely important as well. Okay, so let's move on to the next part of the presentation, which is about the different types of pharmacists in the UK. So before I actually talk about it, let me tell you about the health system in the UK. So the health system in the UK is called NHS, which is National Health Service. It's a very socialistic approach. It's people's own health system. Everyone will get treated equally. And it's absolutely free. If you have a bypass, that will be conducted free of cost. If you have a knee pain or a knee surgery, that will be done free of cost as well. So it's called NHS, and you have two different areas within NHS. One's the primary care, and I'll talk about the next area. So the primary care is pretty similar. I don't know if we still have these type of things in Kerala. The community health centers. Your local community health center. So that's like a primary care GP setup. So we will have GP surgeries literally everywhere. If you have 1,000 houses, for example, or 1,500 houses, there will be a GP surgery there. That will be a smaller setup. You will have qualified doctors, few pharmacists, nurses in a smaller setup, and they will be dealing with less serious conditions like blood pressure, diabetes, cholesterol, chest infection, and all that. If you have your day-to-day problems, if you feel unwell, have a chesty cough, that's the place you go. That's the primary care. That's the primary care setup. So you have primary care. That's the first part of the NHS system, and this is more like a community setup. You will have a GP center in the middle of 1,500 houses, for example, and they will be dealing with less serious conditions. The pharmacist who works really closely with the GP surgeries are community pharmacists. So community pharmacists are exactly like the pharmacy shops in Kerala. And GP pharmacists are a group of pharmacists who work within the GP service, or they work within the community care setup. So the GPs, which are the doctors, and the GP pharmacist works hand in glove. They work really closely in one building, in one setup. Care home pharmacists are pharmacists who deliver medicines or provide medicines to nursing and residential homes. So in this country, a lot of the old people actually unfortunately end up in nursing and residential care setup. And these pharmacists are specialized in geriatric medicine, i.e. medicine in elderly, over 60 or over 70, and they sort of deal with care home patients. So these are the primary care sites. So community pharmacists is pretty much like your pharmacy shop. GP pharmacists are the pharmacists who work closely with the GPs in a primary care setup, in a local community health center setup. And care home pharmacists are the pharmacists who are specialized in dealing with geriatric patients, dealing with nursing and residential care setup. On the other side, you have the hospital pharmacist. They are called secondary care. So primary care is the less serious, secondary care is more serious. So if a GP or a primary care can't deal with a particular patient, and if the patient is really ill, for example, if they have a severe condition like a slowly developing heart condition or cancer, severe GI problems, HIV, multiple sclerosis, all these serious condition patients will get treated in secondary care in hospital. And the hospital pharmacists are the pharmacists who work really closely with the hospital. It's pretty much similar to a hospital pharmacist in Kerala. Home care pharmacists are a type of pharmacist. So home care pharmacists actually get prescriptions from the hospital. Sometimes the UK hospitals and the UK hospital pharmacy they probably have less capacity to deal with patients due to staff problems or due to some other reasons. What they usually do is they outsource prescriptions to home care pharmacy setup. So home care pharmacies are pharmacies that sits outside of the hospital but deals with hospital prescriptions. Hope that makes sense. So hospital pharmacist is the pharmacist actually sit inside the hospital. They deal with the hospital pharmacist or the hospital patients straight away. Home care pharmacists are the ones who deal with hospital prescriptions, but they sit slightly outside of the hospital. The industry pharmacists deal with both primary care GPs and secondary care consultants and hospital. So another important thing, so this is about the community pharmacy. So if you look at the community pharmacy, these are some of the images of community pharmacy. You can see on top left hand corner, you can see a consultation room. So a consultation room is absolutely mandatory for a UK pharmacy, unlike a pharmacy shop in Kerala. What does that tell you? It means that pharmacists in the UK or the community pharmacists in the UK are actually doing way more than dispensing. They're not just doing dispensing, they do a lot of other stuff, which I'll share in the next slide. So you can see the overall setup. You usually have a consultation room, you have pharmacists advising patients, and you have an over-the-counter setup as well. You can see on the different pictures. So what do they do? So community pharmacists, if you look community pharmacists, they do dispensing like every pharmacy place in Kerala. So you get your prescriptions, take your medicines, pack it in a box, send it out to the patients. In addition to dispensing, UK pharmacists and community pharmacy do a lot of stuff, which are number one, health screening. Health screening is like check your blood pressure, cholesterol, diabetes, all of that, using blood tests and urine tests and all that sort of stuff. So they do health screening. They do something called a minor illness clinic. A minor illness clinic is something that is like a small clinic that's been set up as part of the pharmacy, and this minor illness clinic actually deal with minor conditions like cough, cold, fever, that sort of stuff. So, minor illness clinic. They do something called medication review. So medication review is, for example, if the patient's been prescribed 10 different medicines. Let's take an example of codeine phosphate. So imagine if the patient's on codeine phosphate, 30 milligrams 4 times a day, and the doctor also prescribed a laxative for the patient. So what does that tell you? So patient's on codeine. Codeine is obviously going to cause constipation. And doctor also, without realizing it, doctor prescribed another medicine for patient's constipation. So that's the polypharmacy. And that's where the pharmacist actually review the prescription just to make sure that there's no drug-drug interactions, the doses are actually correct, medications have been prescribed appropriately. Certain medicines you need to review in 6 months in the UK, according to the UK guidelines. For example, your antidepressants or antipsychotic medicines need to be reviewed every 6 months to 12 months. Are they actually reviewing it? So this is all the medication review. And a community pharmacist can do medication review in their pharmacy. And once they pick up something, if they pick up anything, they will then inform the GP or the doctor about the problem, and they will then work from there. So there's asthma COPD checks, you can have, you can check your asthma situation if you feel really unwell during night, if you have, breathing difficulties or wheezing, there's opportunities to check your asthma status as well in certain pharmacies. Also, they do a lot of other things like vaccination, for example. They do flu vaccinations in pharmacies. Recently, a lot of the pharmacies participated in COVID vaccination as well. So they do vaccinations. They do addiction service. It's actually de-addiction service. So basically, if a person is addicted to drugs, for example, if they're addicted to, let's say, cocaine, for instance, what we usually do in this case is we prescribe legal drugs. So they take illegal drugs like cocaine, but we prescribe legal drugs like methadone. So methadone, so you give them drugs because the problem is the withdrawal symptoms. If you don't get drugs, is absolutely horrible. People can die from it, or people can have serious implications. So we give them, prescribed drugs called methadone. That's the de-addiction services, and pharmacies run the de-addiction service in the UK. They do smoking cessation as well. So if you're really struggling to stop your smoking, there are ways to stop it. Pharmacists can prescribe nicotine patches, nicotine bubble gums for you to stop smoking, and that is another service they offer in the UK. And also they can do prescribing as well, as long as you finish a 6-monthly course after your pharmacy qualification. You can prescribe medicines to patients as well. So this is about the community pharmacist. Hope hope this makes sense. I'm going to move on to the hospital pharmacy setup. If you look at the hospital pharmacy setup, on the top right-hand corner, you can see a pharmacist speaking to a patient. I'm not really sure if it's possible in India. And on your left-hand side, the left-hand bottom side, you can see the robotic. Robotic system. So this is a system like you type in the medicine, for example, let's say paracetamol. If you type it in this particular chute in what that it basically shoot the medicines down. So this robot will pick the medicine up from the shelf and will shoot it down to the pharmacy, to the dispenser. And hospital pharmacy as well is well advanced in the UK, and I'll go into the hospital pharmacy details here. So you can see hospital pharmacists do a lot of important roles as well here. So first is clinical screening and dispensing. So every prescription, if, like I think Kalamadam briefly touched in the first introductory speech, that doctors diagnose and pharmacists are actually heavily involved in treating and providing medicines to the patients. So every time hospital pharmacists get a prescription, they do something called a clinical screening. So during the clinical screening, what they will be checking is just to make sure, again, like I've said, is there any drug-drug interactions, any DDIs? Has the medicines been prescribed according to the guidelines? Are the medicines well within the dose? is this medicine appropriate for the patient? For example, what if the patient's got some renal failure? Certain medicines, a lot of these medicines are not suitable for patients with renal conditions, patients with liver conditions. These medicines are not suitable. What if the patient is pregnant? So there's lots of things they look at. It's the clinical screening and dispensing. And just to add here, in the UK, the treatment is based on evidence-based medicine. So the treatment protocols are based on evidence-based. Everything you do in this country has to have an evidence. So doctors can't prescribe medicines left, right, and center. So they have to have a proper evidence to prescribe the medicine. So that's what pharmacists will be checking. Is there any problem with this medicine? Is this medicine safe and effective for this particular patient? So clinical screening and dispensing of medicines. Second is the patient education and counseling. For example, let's say patient's been prescribed simvastatin. So you can have simvastatin with grapefruit juice, for example. It's a drug-food interaction. So the pharmacist will be advising about the different drug-food interactions, or how can you take this medicine? When do you take this medicine? Say for example, penicillin. You need to take the medicine on an empty stomach. That needs to be advised. For example, certain side effects. So amoxicillin, after a few days, some people experience diarrhea. So you need to warn them about some side effects. So patient counseling is about drug-drug interactions, drug-food interactions, any potential adverse events they need to look for, any warning signs. So everything about the medicine. That's an important responsibility of the pharmacist. So pharmacist, of course, is a very reputed profession in the UK, and they do teaching sessions to nurses, junior pharmacists, doctors about drug-drug interactions, treatment guidelines. Also, pharmacists do ward rounds with doctors. So the ward rounds is the opportunity to go with the doctor, take the patient case, see how the patient's feeling, what are the different medicines prescribed, is there anything to be added, anything to be removed. That's the opportunity for pharmacists to input their thoughts during the ward rounds. They do something called clinical meetings or multidisciplinary meetings. So these meetings are really important, especially about the complex patients. So if a patient is really not responding to a particular medicine, that's the time you do a multidisciplinary meeting and you discuss about different options for that particular patient. Hospital pharmacists are actually involved in clinical trials and research a lot as well. So if you know the UK landscape, all the UK universities are affiliated to a UK hospital. So UK hospitals or NHS have the state-of-the-art facilities in terms of doing research. So hospital pharmacists actually play an important role in doing clinical trials and research. So early access program, I'm not really sure if we have that in India. So early access program is like, say for example, if you finished your phase 3 clinical trial for a particular medicine, you can use certain medicines after phase 2 and phase 3, which means prior to obtaining marketing authorization or prior to obtaining license, you can use certain medicines after phase 2 and 3 for certain types of patients, like oncology patients, for example. Because there's no good medicines available existing. So that's called early access program. So early access meaning making the medicines early for a particular patient, even before the marketing authorization and licensing. And pharmacists play an important role in early access programs or expanded access programs. Pharmacists are important in writing guidelines about how to use a particular medicine. And they play an important role. Pharmacists do audits about the antibiotics usage, for example. A big thing in the UK at the moment is the overusage of antibiotics, which I'm sure is the case in India as well, because clinicians are prescribing antibiotics left, right, and center without looking at the implications of it. So we have audits in the hospital just to evaluate the usage of antibiotics. Has the antibiotics been prescribed appropriately? Though drug formulary creation, drug formulary is the list of drugs that can be used in a particular hospital. The creation of drug formulary and the addition of new drugs into drug formulary is actually done by pharmacists. Next is the medicines information. Medicines information is about complex scenarios, like for example, an HIV patient, let's take an example of an HIV patient who is pregnant, who requires a particular medicine. And as you look at some of the prescribing information or summary of product characteristics or product license, you can see a lot of these medicines are not licensed in pregnant women because there's no phase 3 clinical trials. There's no phase 2 or 3 clinical trials possible in pregnant ladies due to ethical reasons. So if a clinician has any questions about using a particular medicine in a particular type of patient, for example, a HIV patient who is pregnant, they will contact the medicine's information for further advice. Or can I use this particular medicine for a pregnant woman? Do you have any data? Do you have any paper published anywhere? Do you have any case reports? Any particular cases anywhere in the world? So that's the medicine's information about the complex queries. Pharmacists actually lead the medicines information unit in many of the hospitals. Then drug history taken and prescribing, like I've said, hospital pharmacist and community pharmacist can prescribe as long as they finish a course for a period of 6 months. So you take the history, drug history, and prescribe medicines appropriately to patients as well is possible. So in a nutshell, if you look at the different variety of things hospital pharmacists actually do, they do a lot of stuff in addition to regular dispensing, like we usually see in some of the hospitals in India. And I'm sure things are changing in India. I know, like hospital, for example, I've seen some sort of an advancement in Vellore, for example. Pharmacists are doing a bit more advanced roles, but I'm not really sure about the other places. But yes, they do a lot of stuff. Now we talk about industry pharmacists. So I was a community pharmacist. I worked in community, worked a short period in hospital as well, then moved into the industry, and that's my sort of background. So in terms of the industry pharmacist, you can do a lot of stuff in industry. So the first one is medical affairs. So I work within medical affairs. So different roles is medical information, medical science liaison, medical advisor, medical lead, medical director, country lead. I look after 3 different, UK, Ireland, and Nordics. So I've got about 5 countries. So I'm leading Northern Europe. And what medical affairs do, I've got a separate slide for medical affairs, which I'll talk about it then. So we do scientific exchange, data generation, market intelligence, medical education, patient support program. I'll talk about it in detail in my next slide. You can work in regulatory affairs as well. If you're a qualified pharmacist in the UK, you can work in regulatory affairs, like medical affairs. So regulatory affairs, it's easy to memorize anything in connection to regulatory bodies like MHRA, Medicines and Healthcare Regulatory Authority. You might have heard about MHRA. EMA is the European Medicines Agency. FDA is the regulatory body in US. So regulatory affairs works really closely with regulatory bodies like MHRA, EMA, FDA. And what do? They apply for license. So they prepare the dossier, which is the application. They submit to the MHRA, right, the regulatory bodies, and they kind of liaise with MHRA and deal with MHRA and regulatory bodies in terms of obtaining license or marketing authorization or product license for a particular product. It's a very interesting area to work. I've never worked in regulatory affairs. I know some of the pharmacist colleagues who currently works in regulatory affairs. Also, Reg affairs actually play an important role in some SPC variations, product packaging, the box outside of a particular medicine. That needs to be approved in the UK. So regulatory affairs do that as well. Next, you can do, if you're a qualified pharmacist, you can move into pharmacovigilance within the pharmaceutical industry. So pharmacovigilance, if you think about pharmacovigilance, you're vigilant about the drugs, which means that you will be observing or you will be monitoring the drug safety. So pharmacovigilance is a lot about drug safety. I'm pretty sure you probably know all this information, but I'm just sharing it for those who doesn't know much about it. So basically, you can work as a drug safety specialist, PV officer, and under pharmacovigilance, you'll be dealing with adverse effects, safety monitoring, collection, monitoring, and assessment of adverse events. And another important responsibility of the pharmacovigilance team is to observe for any trends. For example, if a particular medicine gets reported, let's say, tummy ache or GI problems, and it's the responsibility of the pharmacovigilance team to observe the trend to see if the numbers going up or not. Is it really going up? What does that mean? Is there any warning sign? Do I have to alert anybody about it? Is there anything to worry about? That's the pharmacovigilance responsibility. Something called market access as well. I don't think it is happening in India because in the UK, in US, and in Europe, it's a completely different market setup. So market access is even if you obtain license for a particular product, a doctor is not necessarily in a position to prescribe. So the bottom line is, the drugs get licensed by the licenses is licensed by MHRA, so they give them license. MHRA give them license, FDA give them license. But even if the medicine is licensed, the doctors won't be able to prescribe until the HTA bodies approve them, and that part of the process is called the market access part. So that's the licensing. You need the licensing done, then you need to pass the hurdle of market access, and then only the prescribers can prescribe medicines. So this market access involve basically the pharmaceutical companies need to demonstrate that this particular medicine is going to add a value to the patient. That's what the responsibility of a market access manager, like creating value story, compiling clinical data and creating value stories. Speaking to HTA bodies. In the UK, the HTA body is called NICE, N-I-C-E. In Scotland, it's called SMA. So market access will be working closely with NICE and SMC to get the HTA approval for the prescribers to then start prescribing the medicine. So that's the market access part, and it is a big thing in the UK and in the Europe, and also they play an important role in price negotiations. Like, you can't actually sell it in any price in here, so you have to justify. Say, for example, if you've got a new medicine, I'm currently working on a biologic medicine in dermatology for a condition called prurigo nodularis. So if you have to price that medicine, you have to justify why you're pricing. So say, for example, if you're pricing £500, which is 50,000 rupees for an injection, you have to demonstrate the reason why you're pricing the medicine for £500, and that's what market access usually do. And also, you're aware about the sales and marketing. You can do lots of sales roles, marketing roles, key account management, creation of promotional messaging, promotional activities. So a lot of the things you can do. So in a nutshell, as an industry pharmacist, you can work in medical affairs, regulatory affairs, pharmacovigilance, market access, sales, and marketing. There's lots of opportunities as well. Finally, medical affairs. What do we do? So I'm a part of medical affairs. So like I've said, I don't know if pharmaceutical companies in India have medical affairs function. I've seen some medical affairs roles advertised in Mumbai and Bangalore and all the cosmopolitan cities. I'm not really sure if we have medical affairs function in Kerala. So medical affairs is basically work. If you look at the top left-hand corner, we are in between the R&D and the commercial team. So during the phase 2 and phase 3 clinical trials. So phase 2 and phase 3 clinical trial for a particular medicine is usually done by R&D. So when they do the phase 2 and phase 3 clinical trials, they work really closely with medical affairs. So we work closely with R&D. So we're a part of a medicine development from phase 2, but we become a parent, or we become more active when the medicine is licensed and that is available in the market. I'll show you what we do in the next slide. So it becomes a very strategically important function within pharmaceuticals, like R&D and commercial and market access. So we do a lot of stuff which is important for the marketing of the medicine. So if you look at medical affairs, so we provide medical and scientific leadership during pre-launch, which means just prior to launching the medicine in the market, during the launch phase, and just after the launch of the medicine. So what do we do in medical affairs? So firstly, we do something called data generation. So during phase 2 and phase 3 clinical trials, you do clinical trials on a certain number of patients. For example, if you're conducting a dermatology clinical trial in the UK, if it's a rare condition, you're looking at just 200 patients, and if it's a very common condition, you're looking at like 1,000 patients. So worldwide, if you look at the clinical trials, they'll probably doing clinical trials only in 4,000 patients or 5,000 patients. That's all. You don't actually know how it actually works in real world setup. So what we do is we do something called real world data generation once the medicine is available in the market. So you have phase 2, you have phase 3. Then you obtain license to market the medicine. After marketing of the medicine is freely available in the market, and at that point in time we do something called data generation or real world data collection, and medical affairs actually lead data collection. And this real world data collection is absolutely paramount, absolutely important, because this will actually tell you the real picture when you start using medicines in a wider group of patients. We do something called scientific exchange. I briefly touched on it. For example, in the UK, it's evidence-based. You can't just prescribe medicine. There will have to be an evidence. If you have a pregnant patient, for example, you don't know exactly what to prescribe. You know, what they usually do, the healthcare professionals or the doctors, they contact the medical affairs, see, by the way, medical affairs, do you have any clinical data to substantiate, or any case report, or any case study, or some sort of an analysis to say this particular medicine is safe for a pregnant woman. For example, people with renally impaired conditions, people with liver conditions, people who had organ transplants, so they all need to be factored in when you prescribe a medicine in the UK. So any of these niche questions, really difficult scientific questions, usually come to the medical affairs within the pharmaceutical function. And we usually answer about, we have a huge database which keeps a lot of information. For example, I can say, oh, by the way, doctor, you can use this particular medicine for this pregnant woman because there was a case somewhere in Switzerland 5 years ago. We keep that information and we have that information, but doctors don't. So that's where the scientific exchange comes into play. We do approval of materials, and that's my final signatory. I'm a final signatory. So in the UK, before anything goes out of the pharmaceutical company, any promotional messaging, any leaf piece, any presentation, anything that goes out of the pharmaceutical company will have to be approved by a medical signatory. For you to be a medical signatory in the UK, you need to register with MHRA. And for you to register with MHRA and to become a final signatory, you need to be either a medical doctor or a UK qualified pharmacist. So only a UK doctor or a UK qualified pharmacist are allowed to become a final medical signatory. So like I've said, we approve materials, we approve leaf pieces, even a letter to a doctor. If anyone wants to send a letter, for example, if the commercial team or the sales team wanted to send a letter to a healthcare professional about a particular medicine, for instance, that needs to be approved by a medic or a qualified pharmacist, and that's the final signature bit. So we do a lot of that, and that's a part of the compliance requirement in the UK by ABPI and MHRA. We do something called medical education to healthcare professionals. For example, like I said, I'm working on a medicine in prurigo nodularis. Prurigo nodularis is a rare skin condition. A lot of the healthcare professionals, like doctors, don't exactly know what a prurigo nodularis is. So we do medical education sessions to GPs, doctors, consultants, emerging doctors, newly qualified doctors, pharmacists, everyone. So we do medical education to healthcare professionals as well. We do patient support programs. I'll give you an example. Like if you're prescribing, let's say, a biologic medicine. So a lot of the biologic medicine these days actually comes in subcutaneous injections, which means that, if you can, like insulin, you can inject yourself. But the problem is a lot of the patients don't know how to inject, how to do it. So what we do is something called the patient support program. So we will send qualified nurses to patients' houses so that the nurses can teach the patient on how to administer this particular injection. So that's the patient support program. So we deal with a lot of patient support programs to support patients and to educate patients on the safe and the effective use of a particular medicine. We do clinical and scientific expertise to sales. For example, sometimes the marketing team they come back, come to you and say, oh, Ajith, I need a good message. What's the best message? How can you demonstrate the clinical advantage of your medicine or our medicine? So that's where my expertise comes in to say, well, we can use so and so data. It's important. It demonstrates good efficacy, good safety profile over the competitors. So that's my responsibility to advise the commercial marketeer on what commercial messaging to be given out. Also, we do manage a lot of medical projects like early access programs, investigation initiated studies, submission, HTA submission like NICE SMC submissions, submissions to MHRA. We work closely with regulatory. So we manage a lot of medical and scientific projects as well. And this is about the medical affairs. So we do a lot more stuff, but I think these are some of the important points. Now, I really want all of you to get your registration in the UK and become a pharmacist. But what if you can't become a pharmacist? For example, you come to the UK and you've tried your English, but you haven't got the English, but you are still trying. You wanted to become a pharmacist later on in a few years. You can work as a pharmacy technician with your overseas qualification. So pharmacy technician is actually the person who supports pharmacists in community pharmacy and hospital pharmacy. You can work as an accuracy checking technician as well. The accuracy checking technicians actually do the checking process. Say, for example, if you get a prescription for simvastatin or atorvastatin 20 milligrams, you take a box of atorvastatin 20, you check. So this checking process is usually done by accuracy checking technicians, but sometimes pharmacists do as well. So it's usually pharmacist checks and accuracy checking technicians are the ones who actually support. Also, some regulatory and PV jobs in pharmaceuticals can be done without a UK registered qualification. But if you look at the actual advantages of registering as a pharmacist, they're massive. So these are some of the useful websites and links. I'm not going to read through the whole stuff. I mean, you can surely take it. If you wanted to know about the registration in the UK, it's the General Pharmaceutical Council website, which is the pharmacy regulation. Royal Pharmacy Society for pharmacist educational resources. Also, the other websites, the UK government websites about the student visa, about the other visa requirements, shortage occupation lists. So that's all. You can check these websites. They're all useful resources. Like I've said, read them really carefully because the visa rules in the UK changes very often. So it changes like this. So you will see something today, and in a few months that disappears. So make sure you check the UK websites, the visa websites on a regular basis, just to update you. And just to summarize, registration in the UK takes a bit of time, but definitely worth it. Pharmacists in the UK can prescribe medicines as well after appropriate qualifications. Community pharmacists carry out a lot of other services, like you've seen. In addition to dispensing, hospital pharmacists play an important role in the hospital multidisciplinary team. Industrial pharmacy is a great area for pharmacists to pursue their career. And the area where I work, which is medical affairs, is a key strategic function in the UK and Europe, which pharmacists can make a decent career out of. I'm stopping here. Thank you so much for this opportunity. Hope this makes sense. If you have any questions, feel free to ask.
Thank you so much, sir. It is indeed a very good presentation. So we are fortunate enough to listen from you, sir. Thank you so much. And I'm sure that participants also get benefited by listening to you. So we got an insight about the regulatory council as well as regulatory society, the registration process over there, and the tricks and tips that you have suggested that I think that will really help us, those professionals who are pursuing a career over there. And your session was indeed very good, especially regarding the role of pharmacist in the hospital setup, community setup, and industrial setup. All these points actually will be benefited for our students. So I think students may have many doubts regarding the career opportunities as well as the research opportunities. So shall we have a discussion now, sir? Shall I read out the
Sure.
question?
Yeah, of course. Yeah, sure.
So students wants to know whether there are any scholarships available for this program, for registration process.
Yeah, for the like I've said, I've tried a lot of different things as well. So in terms of the scholarships for the overseas registration program, unfortunately, there's no scholarships available because it's basically for you to become a pharmacist in the UK. And I mean, if you're in the UK already, you can apply for different loans, interest, less interest, but unfortunately there's no scholarships for the OSPAP course.
And Manjula ma'am wants to know whether is there any age limit to register as a pharmacist in UK?
No age limit. No, I mean, there's no discrimination in terms of age, color, sex, nothing. It's just absolutely possible at any point of time. And like I think Dilip sir actually mentioned about the stringency. I mean, it's very strict in terms of the process. It's very strict. If your paperwork is perfect and if you have everything in place, your qualification, your English, and your transcript and everything, if everything is in place, it is a fairly straightforward process. There's unlike sometimes you see, I mean, I've experienced this during my registration time in Kerala that I had to go back and forth 50 times for different things, and you don't see them in here. It's straightforward.
Okay, thank you, sir. How can we work in government sector there? Asked by Sonu.
So the government sector is NHS. So like I've said, that's the health system in the UK. So you have private hospitals as well. So the government system is called NHS, which is the National Health Service. It's like any other private job you apply for. So basically, all the hospitals advertise the vacancy. You apply for it. They will invite you for an interview. So usually a telephone interview first. Then there will be a face-to-face interview, and during the face-to-face interview, they will ask you to present. Like I've mentioned, presentation is absolutely vital. They will ask you to present on a particular topic, and that's it. There's not like any PSC tests or anything like that. It's just purely interview based. They will invite people for or certain posts, apply for it, attend the interview, and job done.
And one more question from Sonu: that can we outline the payment scale for each pharma career?
So the payment is I mean, I can tell you a ballpark figure. That's absolutely fine, because the thing is, it depends on a lot of stuff. For example, if you wanted to start off in the NHS after qualifying as a pharmacist, you will be entering in a particular band. I think it's band 6 or 7. Band 6 or 7 is roughly like £30,000 per year, which is 30 lakhs per year. But when you say in lakhs and in numbers, you think it's huge, like, but you need to factor in the living cost. You need to factor in lots of other things, and you move up. So band 8, you will get more, so like £48,000, which is 48 lakhs, maybe roughly 45,000, 45 lakhs. Then if you're a specialty pharmacist, you get paid more. And if you're in private, your starting salary will be like 40,000, 38,000 pounds, which is about 38 lakhs per year. And so it just varies. We can't exactly tell you. And after a certain stage, it's completely up to you. I mean, if you're really smart, really intelligent, really knows your stuff, you'll be going up. You'll be shooting up the ladder very quickly. But some people they like to stay in their positions. They will be like a pharmacist for life. They like it because they don't want to take additional responsibilities. But if you are really good at what you do, then of course you can progress. You can move up to a good salary, and it depends on you as an individual. Even if within the hospital, if you entered the hospital in band 7, if you wanted to move into band 8, it's up to you. You know how good you are, how how involved you are in terms of the process, how good you are in terms of your interpersonal skills, speaking to the patients, your clinical understanding, a lot of stuff. The growth in the UK is very much individualistic. It depends on the person.
Okay, sir. And one more question from Adra, that is payment of fees in the university is either one time or 2 times, multiple times.
Oh, they will even give you like monthly payments, so you can pay. So when I've studied, of course, like I've said, that was my struggling period. So when I've studied, I think I've paid 25% of the fees initially before the start of the program. Then I think I've paid every month, and even after the finishing the course, I haven't paid the whole amount. Then I had to, wait for another month to pay. So they will give you a lot of flexibility, and that's the beauty of the universities in the UK. They want students, they want brain, they want clever people in this country. So they will allow and they will give you every possibility to pay your fees. But they will make sure that you pay the fees. They won't give you any they don't take any sympathies or anything. You will have to pay the fees, but they are very flexible.
Okay, sir. Then this OSPAP course is required to work as care home pharmacist in UK, or any other optional courses available there?
So in terms of the process, it's very streamlined. There is no lateral entry from the backside, nothing like that. So you have to do your pharmacy qualification, finish your English, do the OSPAP. That is a mandatory requirement, 1 year. Do the pre-registration, pass the pre-registration exam, then register as a pharmacist. There's no other shortcuts. Regardless, if you are a doctor in pharmacy in India, for example, with 50 years of experience, coming to the UK, you will still have to go through the same process. There's no difference.
Sir, is there any additional course or requirements other than pharma degree there to work in regulatory or pharmacovigilance sector?
No. So if you are a pharmacist, qualified pharmacist in the UK, you can work in medical affairs, regulatory, PV. All you need is a pharmacist qualification. But I know some pharmaceutical companies even accept applications from outside. So for example, if you're an overseas qualified pharmacist, came to the UK, you might get an opportunity to work for a pharmaceutical company even prior to registering as a pharmacist. So some pharmaceutical companies actually accept overseas qualifications, but some of them is really particular about qualifying as a pharmacist. So that's the entry. So once you're in the pharmaceutical industry, of course, if you have an MBA, it adds a lot of value. And of course, if you have a PhD or a PharmD, it adds a lot of value as well. If once you start your job, it helps you to progress and it adds a lot of value to the CV.
Okay, sir. So I would like to know, can you please brief about academic and research opportunities also?
So, I mean, I haven't got any direct experience, so I'm not in a position to sort of answer it in a proper way. But what I can tell you from my experience is, if you're a qualified pharmacist and working in a hospital, you have the opportunity to do some clinical research and clinical trials. In terms of the academia and PhD, I'm pretty sure, Dilip sir and Kalman, they all know me because I'm not a studious guy. So I was going to do PhD. At many points, I've thought about it. Even I submitted my application to a university. Then I've realized that that's not me. So I have tried many times. But so PhD in this country is very reputed, as you can imagine. All universities provide a lot of opportunity for people to do a lot of research. A lot of important research is, if you look at, for example, take the COVID AstraZeneca vaccine. The clinical trial is actually done in Oxford Hospital, which is 30 minutes from my house. So they do a lot of clinical trials in the UK. If you take an international clinical trial, if you take any international clinical trial run by a pharmaceutical company, there will be at least 5 UK centres, whether oncology or immunology. Take any area, HIV. So research is very important. UK is a very important research hub, but I'm not really sure about PhD scholarships. I know that the UK nationals, because I'm a citizen in this country, UK nationals, we get scholarships. I mean, I can do a PhD in a really, not very expensive for me. But in terms of that question, PhD, all I can tell you is PhD is very good in this country if you can do it. I can tell you it's going to be a lot of work, because there's no easy way out here, because they will make you work, because they want proper research scientists. And finally, there will be lots of scholarships as well, but I'm not in a position to comment, but because I don't exactly know the answer for it.
One question from Hari Krishnan. Can we work as pharmacy assistant hand in hand alongside attempting for our OSPAP?
When you actually do the OSPAP, you can work part-time. So the good thing about the OSPAP, or the Overseas Pharmacist Assessment Program, is that although the universities say it's a course for 1 year or 10 months, you don't have university classes every day. So for example, in a week, you probably have 2 days in a week in the university, and the rest of the days you can work as a pharmacy technician or a pharmacy assistant and earn your money that way. That's what exactly I did. So when I've done the OSPAP, I was actually only attending university for 2 days a week, which was Thursday and Friday. The rest of the days I was working in a pharmacy as a pharmacy technician. So yes, to you, Hari Krishnan, you can do it. You work in a pharmacy and you can do your OSPAP at the same time.
Another question from Angela ma'am. Does pursuing postdoctoral program in UK helps a pharmacist in getting a job in UK? In that case, is OSPAP necessary?
Yes. So could you repeat that question for me, please?
Does pursuing postdoctoral program in UK helps a pharmacist in getting a job in UK? In that case, OSPAP is necessary or not?
Yes, unfortunately, it's a very streamlined process, like I've said. So you have to do OSPAP if you're a foreign qualified pharmacist. If you've qualified in India, and if you're in the UK, you have to do the OSPAP route. But there's some exemptions. Say, for example, if you're a qualified pharmacist in India and you've practiced, say, for example, if you've practiced in Australia for a period of 2 years or 3 years as a pharmacist, then you can convert your Australian pharmacy into UK pharmacy fairly easily. But if you're coming straight from India after sort of finishing your PhD or if you wanted to do postdoctoral here, regardless of what you do, like I've said, you still have to go through the OSPAP and pre-registration route, and that's the license, that's the registration. Like I've said, the pharmacist license or registration in this country carry a lot of weight. You can, for example, pharmacists can attest certificates. Local community pharmacist is like the professional for a local crowd. So it is a very reputed profession, and hence why the standards are extremely strict. So regardless of what you've done or what you're doing in the UK, if you're an overseas qualified or Indian qualified, you will still have to do the OSPAP and the pre-registration route.
Another question from Anita. PG degree in UK, how far helps a candidate?
Are you talking about the normal PG? Yeah, okay. So I know a lot of the Indian students are doing post-graduation in the UK. Like, if you're doing it, my sort of suggestion is do it do a proper qualification. I mean, a proper subject, because I've seen students coming here for all different types of qualifications. Because things like advanced drug delivery, for example, or something around pharmacology, advanced therapeutics, toxicology, that type of things. Which you need to, if you wanted to pursue a job, you need to make sure that you do a proper university qualification, like a serious qualification, and then you need to do a good project as well for you to then apply for different jobs.
I think that is the end of the question. Many of them expressed that the session was very interesting and excellent presentation. Thank you so much, sir. And Nishit sir commented that we'll have another lecture on this series related to research in UK by the middle of May 2022. So in that session, we'll be having more questions regarding to the research aspects. So thank you so much, sir. Thank you so much for sparing a time with us. Thank you.
Thank you so much. Thank you. It's been a pleasure.
Thank you so much, sir. It was truly inspiring, informative, and very energetic session. On behalf of all the participants, I would like to thank our very knowledgeable speaker, Mr. Ajith Adai, sir, and wishing many more success to you, sir. And also thanking you, Dr. Sujay ma'am, for the efficient moderation.
Ms. Sonu,
Yes, yes, sir.
can I ask a question to Mr. Ajit Adai, please?
Yes, sir. Please, sir.
Mr. Ajit Adai, good afternoon. Hello.
Hi, good afternoon.
Can you hear me?
Yes, I can hear you. Yes.
Let me first congratulate you for your excellent presentation. Okay.
Thank you.
I felt that I am in UK for some time. During the time you had spoken, I felt that as though I am in UK. Okay. Right now, I would like to ask you, are pharmacists in UK allowed to prescribe medicines to patients in certain cases of emergency or common ailments, for common ailments? For example, I know that in Canada, Australia, and New Zealand, pharmacists are allowed to administer even vaccines during COVID period. And what is the situation that prevails in UK now?
All right. Okay. Thanks for the question. So two questions. One is, are pharmacists allowed to prescribe in the UK? The answer is yes. So after qualifying as after finishing your qualification as a pharmacist in the UK, once you become a UK qualified pharmacist, then you can do something called an independent prescribing course. The independent prescribing course will last for a period of 6 months. So once you finish your 6-monthly independent course, then you are allowed to prescribe. Having said that, you can't prescribe anything and everything, so you will have to work with a GP. So during the independent prescribing time, you will be specializing in a particular area. Like, for example, you can take respiratory or diabetes. Then you work with a GP, which is a doctor, for a short period of time. Then you can prescribe certain medicines. Say, imagine if you have a patient with recently diagnosed of cancer, for example. So you can't prescribe to that patient. So you're allowed to prescribe for certain conditions under certain circumstances based on your expertise, based on the expertise you are developing under the guidance of a doctor. So you can prescribe. So from a primary care perspective, you can prescribe pretty much everything for all the common conditions like asthma, chest infection, hypertension, diabetes, cholesterol. So you can. Second question is vaccination. Yes, the pharmacists in the UK were also allowed to do vaccinations to patients during the COVID time, and they are allowed to do flu vaccinations, flu jabs. So pharmacists in the UK actually do that as well.
Thank you. And just one more question. The Department of Drugs Control, like in India, I think it is called as Medicine Control Agency in UK. I don't know whether it is right or not. What are the main laws that prevails there in UK regarding the regulations?
Yeah, very, very good question. So you have, I think, we like drug inspectors. We have inspectors as well in the UK, and they're from General Pharmaceutical Council. So they are employed by General Pharmaceutical Council. Exactly like in Kerala, it's a scary situation to have an inspector, on site because the regulations are very strict. So basically, they look for everything. They look for the cleanliness, appropriate record keeping. So in terms of the regulations, there's lots of different things. It's a huge area. So I can tell you some of the important things. So they firstly they look for the presence of a responsible pharmacist. It's mandatory to have a UK qualified pharmacist on site. Number one. Number two is all the control drugs, all your schedule 2, 1, 2, 3, and 4 drugs will have to be in a locked cabinet, and you will have to maintain a register for it. And they will inspect the register to make sure that the number tallies. Number three is your temperature monitoring. You need to do temperatures for the pharmacy, and you need to do the temperature for your fridge as well on a regular basis, just to make sure that the safe storage of medicines is happening. Number four is about the patient's seating area. How clean is it? Are you maintaining it properly? Are you dealing with patients properly? So they do that. Then they look at the shelves to make sure, is the shelves tidy? Has the expiry date been checked? Is there any, if they pick up one expiry medicine from the shelf, that is a big problem, because we have to do expiry date checks. I think we do in every month or every other month. So expired. So are all medicines in date? Is it expired? Have you got sufficient stocks? Is your area clean? So then there's a dispensing history record. So that's like a software. So you input the patient details, and it will tell you the different medicines the patient's taking. So they check the dispensing software to make sure you have a software in place. They also look at something like, for example, are you keeping the information confidential? Data privacy. That's important. It's if I start speaking about the regulations, there's probably need another session to speak about it. It's very, very strict and stringent, but very streamlined. These people are not scary. They will come and help you. They will advise you different things. They will basically, if say for example, if the drug inspector finds out any problem, they will advise you the best practice. How can you make it right? What are the things you should be doing? They'll be advised. They'll be more like an advisory rather than a scary person. So they it's very interesting area. So we have similar. I can't remember the titles. They're drug inspectors. They're from General Pharmaceutical Council, and they visit pharmacies. They can come in and they usually inform you in advance. That's the good thing. They will send you a letter like a month before to say, oh, we are actually there in the area to inspect your pharmacy, so that you can prepare for it. Sometimes they will come and announce. They will, especially if there's any complaints. In this country, even the members of the public can complain to General Pharmaceutical Council. So, for example, one person can write, oh, this particular pharmacist was really rude to me when I was there. So that is a complaint. So if they get regular complaints about a particular pharmacy, they can actually do an unannounced visit as well, which can be tricky. So yes, regulations are very strict, and we have inspection process in place as well.
So thank you so much for your valuable
Thank you.
information.
No problem.
I'm reserving the questions due to paucity of time.
That's all right. It's fine. I'm
Thank
happy
you.
to take on the questions. I mean, yeah, it's okay. No, I understand. It's probably 8 or 9 p.m. there as well.
Thank you so much, sir. Thanking you once again. Before moving to the official ending of the function, I would like to invite all of you for the few upcoming events of KPGA on 6th and 7th of April. In association with St. Joseph College of Pharmacy, Chardala, KPGA is also being a part of the program honoring a legend in pharmacy education. Dr. Sister Betty Kala is being honored on the day. So we are inviting all of you to join for the program, as we are having the live YouTube streaming will be there. And on the 9th of April, in association with IPGA Kerala chapter, KPG is inviting all of you for the webinar on marketing yourself, resume writing, and interview tips. by Ms. Minu Trisa Jose, Regional Marketing Manager. And we will be resuming our webinar series with the Module 7 on 1st of May 2022 on the topic An Overview of Pharmacy Practice in the Middle East. And the speaker will be Mr. Rajesh Talaparambat, Senior Clinical Pharmacist from Saudi Arabia. Hope to see you all for the upcoming programs of KPGA. And at this juncture, with much happiness, I would like to invite a highly talented and efficient pharma professional, Mr. Abdul Nasser K, and list Quality Manager Accreditation, Drugs Testing Laboratory, Thrissur, for proposed vote of thanks. Over to you, sir.
Thank you, Sonu. Am I audible?
Yes, sir, you are audible, sir.
Okay. Good evening, all. It's given me an immense pleasure to deliver the vote of thanks to all the dignitaries assembled here on behalf of Kerala Pharmacy Graduate Association. First of all, I would like to congratulate KPGA for conducting such a useful webinars, and so happy to thank all the executive members of KPGA for organizing this webinar. Next, I would like to thank Dr. Kaladi, Professor and Head, College of Pharmaceutical Sciences, Government TD Medical College, Alappuzha, for chairing today's session. Thank you, ma'am.
Thank you.
Next, today we have an excellent and informative presentation from Mr. Ajith Adai. I would like to deliver sincere gratitude to today's invited speaker, Mr. Ajith Adai, Medical Affairs Lead and Final Medical Signatory, Galderma Limited, for sharing his knowledge and experience on the topic career opportunities for registered pharmacists in UK. Thank you, sir.
Thank you.
Next, I would like to thank Mrs. Gladys P. Kachapalli, Drugs Inspector, Ernakulam, for delivering today's welcome speech. Thank you, ma'am. Then I would like to thank Dr. Dilip KJ, Professor, Pharmacy College of Pharmaceutical Sciences, Government TD Medical College, Alappuzha, for giving introductions to today's module. Thank you, sir.
Thank you.
Next, I would like to thank Dr. Suja Abraham, Professor, MGM Silver Jubilee College of Pharmacy, Ernakulam, for moderating today's webinar. Thank you, ma'am. I also thank Ms. Sonu Benny, who is the master of the ceremony of today's program. And at last but not least, I would like to thank all the attendees, including the senior faculties, students, and other dignitaries who have joined through online platforms. Over to Sonu.
Thank you so much, sir. Thanking you all for your valuable time and the much valuable presence overall the session. Chase your dreams and create your success story. Wishing you all the very best. And until we meet again, it's me, Sonu Benny, signing off. Let's all raise for national anthem.
Jana Mana Adhinayak Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkala Vanga Vindhya Himachala Yamuna Ganga Uchchala Jaladhi Taranga तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Stay safe and stay healthy. Thank you so much once again. Thank you so much.
Thank you, everyone. Bye. See you.